Continuation. Now we are going to learn about obesity. Obesity is the excessive weight gain of the body due to heavy accumulation of fat and adipose tissue beneath the skin and around certain internal organs. In obesity, the body weight goes up to 20% or more above the ideal or desirable standard weight. Obesity is a serious health hazard and one of the risk factors or desirable risk factors in coronary artery disease, gallbladder disease, diabetes mellitus, etc. It is often associated with high mortality rate. Women are more prone to this disease more than corpulence than men. They take this condition more rapidly after the first delivery and also after the onset of menopause. Obesity in general results from a combination of genetic factors and personal habits. Overeating, excessive caloric consumption, and large intake of foods, especially alcohol, are the immediate and existing causes of obesity. Malfunctioning of some endocrine glands such as thyroid, pituitary, sex glands, etc. Hormonal imbalance, hereditary factors, inert or sedentary lifestyle, etc. are some of the well recognized predisposing causes of obesity. Kinds of obesity. Based on different grounds, several kinds of obesity can be recognized. Some of them are hypothalamic obesity, psychological obesity, regulatory obesity, physiological or metabolic obesity, hypertrophic obesity, and hyperplastic hypertrophic obesity. So, hypothalamic obesity, this is the obesity that results from lesions in the satiety center located in the hypothalamus. The center in the active state cause the cessation of heating. However, lesions in the satiety center produce sensations as satiety and cause hyperphagia, overeating, which in turn leads to obesity. Then psychological obesity. This is obesity due to psychological reasons. In this case, a person indulges in overeating when he feels bored, unloved, worried, or discontented. In due course, he derives physical pleasure from overeating and finds it an outlet for his emotional disturbances. This makes him an addict to overeating. So, psychological obesity is of two kinds, developmental and reactive. Developmental obesity begins from childhood onwards and it depends on food intake. So, reactive obesity begins with some distressing experience such as nostalgia, illness, separation, or death of dear ones and other maladjustment problems. Then regulatory obesity. People with regulatory obesity have no apparent metabolic abnormalities. They simply eat away large quantities of energy-rich food and far excess for their body needs. That is regulatory obesity. Then metabolic obesity. Metabolic obesity results primarily from a disorder that impairs the catabolism of carbohydrates and fats. An example is hypothyroidism. Metabolic obesity results primarily from a disorder that impairs the catabolism of carbohydrates and fats. An example is hypothyroidism. Then hypertrophic obesity. This is obesity in which there is increased fat storage in adipose tissue but without an increase in the amount of fat storing cells. In general, hypertrophic obesity has its onset in adulthood. It is not highly problematic and is easy to treat. Hypertrophic obesity. So, which are the major types? Hypothalamic obesity due to lesions, then psychological obesity, regulatory obesity without no reason, just metabolic abnormalities. Metabolic obesity and hypertrophic obesity, hyperplastic hypertrophic obesity. Then clinical effects of obesity. Obesity is a serious health problem. It forms a major predisposing factor for cardiovascular disease, cancers of breast and colon, osteoarthritis, diabetes mellitus, gout, hernia, diseases of liver and gallbladder. Then corpulent persons usually experience backache, joint pain, lethargy, fatigue, and exhaustion even after a mild exercise. They are easily prey to acute disease and they succumb to them much more readily than do their other persons. Skin conditions such as eczema and chafed and painful skin are also much common among obese persons. Accumulation of fat in the chest and abdomen may adversely affect the functioning of internal organs. In general, the mental activity of highly couples persons is seriously impaired, although there can be notable exceptions. On the whole, it becomes more certain that obese persons are more severely inflicted with mental, physical, and physiological problems, and so they have only poor life expectancy. Next topic, starvation. Starvation is an extreme case of undernutrition in which there is a total deprivation of food or the intake of energy and nutrients is far below the critical level. Prolonged and extreme starvation is fatal. It may cause permanent and irreparable damage to tissues and vital organs and ultimate death. Complete deprivation of food in all probability causes chemical alterations in the body. Often it produces a poisonous effect due to the formation and accumulation of ketone bodies. In case of slow starvation, the vitality of this tissue may be reduced and they become more liable to tuberculosis and other diseases. Starvation usually causes several nutrient deficiency diseases such as kwashiorkor, marasmus, rickets, beriberi, scurvy, pellagra, pernicious anemia, diarrhea, etc. In starving persons, there will be considerable loss of muscle mass and stored fat, since stored fat and muscle glycogen are mobilized as energy source. Starving individuals are characterized by extreme loss of weight, edema, and emaciated appearance, pale and dry skin with rashes, extreme lethargy, fatigue, and exhaustion, etc. Sometimes partial starvation or fasting is good as a method of treatment in some diseases which are associated with excessive eating, obesity, etc. Fasting is this is starvation. Next topic, fasting. Fasting is a willful abstaining from food and drink. Fasting practiced for thousands of years in the past as a religious and spiritual custom is also a cure for several diseases and disorders, and now on the rehearsal for a comeback. Total suspension of food and drink produces two imminent results. Body becomes thinner and lighter since it draws upon its stored nourishment. Body temperature gradually falls low. Body weight decreases with fasting time. This decrease is not linear. The body of adult human being has remarkable capacity to survive without food for long periods. How does this body adjust itself to prolonged fasting or starvation is not fully understood. However, studies on the physiological and biochemical adaptations of starvation have revealed that the ability of the body to mobilize its internal resources is very vital for survival in the absence of food intake. Physiological changes during fasting. The major physiological changes taking place in the body in response to prolonged fasting or starvation is drop in the levels of fuel molecule in blood, progressive decrease in basal metabolic rate, mobilization of reserve nutrients with a drastic drop in their store, synthesis of glucose in the liver from glucogenic amino acids, namely alanine, synthesis of alanine from pyruvic acid, steps to control protein loss, formation and accumulation of ketone bodies, changes in the role of renal cortex, then hyposecretion of insulin and hypersecretion of glucagon, drop in the level of fuel molecule and remedial steps. The immediate effects of fasting include drop in the level of all nutrients and fuel molecules in the blood and considerable decrease in the store of reserve nutrients. Body needs fuel molecules as a source of energy for vital functions. The principal fuel molecule is glucose. Its most critical user is the brain. For brain, it is as essential as oxygen. So rapid and prolonged drop in blood sugar level may very severely affect brain functions. It may cause behavioral changes, confusion, coma, changes to brain cell, and ultimate death of the person. The main glucose reserve of the body is the liver glycogen. Some amount of liver glycogen is not ordinarily available since liver will conserve it to meet stressful emergencies. Fall in blood glucose level will be followed by the mobilization of glycogen from liver, fall from adipose tissues, and protein from skeletal muscles. The glycogen store of liver may be converted to glucose by glycogenolysis. Stored fat or triglycerides will be broken down to free fatty acids, which can supply energy to tissues other than nerve tissue. Muscle protein will be broken down to free amino acids. Some of these amino acids are glucogenic, and they will be utilized in liver for the synthesis of gluconeogenesis. Prolonged starvation causes the continued breakdown of skeletal muscle proteins. As a result, skeletal muscle may rapidly waste away, seriously affecting the proper functioning of the body. Of all the amino acids, alanine is the principal substrate for the synthesis of glucose in liver. The rise in the level of alanine in blood during fasting is surprising. This reveals that apart from protein breakdown, some amount of alanine is synthesized from some immediate precursors, mainly pyruvic acid. The conversion of alanine to glucose occurs in liver in the cycle of reactions called alanine cycle, which is somewhat similar to the Cori cycle, in which muscle lactate is converted to liver glucose. Along with that, fall in BMR. As fasting or starvation continues, several factors come to the aid of a person. Accordingly, his basal metabolic rate slows down and the body's need for calories gets further reduced. The starved person engages only in minimal spontaneous activities and becomes more sparing in energy expenditure, so he uses energy more efficiently and more judiciously. Steps to control protein loss. A starved body resorts to strong measures to control protein loss and thereby to conserve its integrity. The skeletal muscle considerably reduces the rate of protein breakdown and the release of alanine. As a result, the synthesis of glucose in liver becomes minimal. It has been observed that during the 4th and 5th week of fasting or starvation, liver and kidney together produce only the least minimum of glucose, and virtually all this glucose goes to brain. As a result, the conservation of protein during fasting, urination for the excretion of nitrogen becomes very much reduced. So a starved person needs only less intake of water. If sweating is minimal, he needs only a cup of water a day to maintain his body's water balance. Then accumulation of ketone bodies. During fasting, the supply of glucose to brain progressively declines. This deficit would be made up by the supply of a substitute source of energy, namely ketone bodies formed from fatty tissue. They include acetoacetic acid and its derivatives acetone and beta hydroxybutyrate. The substrates yield energy on oxidation, and brain will adapt itself to use them as energy substrates in place of glucose. Brain has the enzymatic machinery to utilize ketone bodies as a substitute source of energy. The metabolism of fatty acids does not ordinarily produce ketones. However, during starvation, fatty acids are released from fat deposits and are oxidized in liver, forming acetoacetic acid. Blood transports this acetoacetic acid to other tissues to provide them energy. The accumulation of ketone in blood during starvation and also in persons with a high fat diet is often called ketosis. Ketosis during fasting evidently signals the response of the body to the depletion of the supply of glucose. Change in the role of renal cortex. There is a striking change in the role of renal cortex during fasting or starvation. Normally, renal cortex is a minor partner of liver in glucose synthesis, but during starvation, it becomes a major producer of glucose and it synthesizes more glucose from amino acids than synthesized by liver. This shift is due to a change in the acid-base balance in the blood caused by the accumulation of ketone bodies. Then, hormonal response to starvation or fasting. The mechanisms which bring about adaptive changes during fasting and starvation are not fully understood. Certainly, hormones do play an important role. During prolonged starvation, insulin stands at a much lower level and glucagon at a higher level than the normal. Insulin and glucagon are antagonistic in action. Insulin in optimal level stimulates synthesis of fat and inhibits fat breakdown, promotes the uptake of glucose and amino acids by muscle cells, inhibits synthesis of glucose in liver. So its hyposecretion minimizes this process. Glucagon normally promotes the synthesis of glucose in liver, so an alteration in the balance between insulin and glucagon during starvation may promote the activity of liver for glucose synthesis and fat metabolism. Significance of fasting. Fasting is a self-imposed control on the excessive desire, temptation, or urge for overeating. Fasting is the best way to coping with emergency situations in which food supplies are very much limited. Fasting is a voluntary adaptation which enables the body to adjust itself to lack of shortage of food. Fasting and dieting are particularly useful in weight reduction in obese persons. Fasting is medically important in controlling or curing several hard to treat disorders and diseases ranging from arthritis to migraine and also from skin disorders to allergies. Clinical studies in Scandinavian countries have revealed that fasting is a very effective treatment for rheumatism, especially if the patient follow up with a vegetarian diet. Other studies have shown that fasting is successful in lowering blood pressure and treating chronic migraine and arthritis. Neurological studies have found that fasting will considerably lower the levels of stress hormones and at the same time will raise the level of serotonin. On the whole, it appears that fasting works like a reset button for the self-regulating mechanism of the body. The metabolic switching takes place when the body starts living on its own reserves, has a wonderful healing effect on several diseases. There is no way of achieving permanent weight reduction without reducing the intake of calories to less than the actual expenditure. So, greater such a difference between the intake and expenditure of calorific energy, the faster would be the loss of weight. From a purely biochemical standpoint, the most effective way of reducing body weight is complete fasting, in which stored fat is the major source of energy for brain and other tissue. However, overall, total fasting for a long period of time can be dangerous, so we must always refrain from long fasting and must avoid too much exercise during fasting, especially during the initial phase. Occasional and partial fasting, in which a person subsists only on liquid food, such as juices of fruits and vegetables, is considered to be useful for cleaning the body from toxins and dead and damaged tissues, and also for giving rest to digestive system. Then, role of minerals. Mineral inorganic elements form only a very small fraction of the body weight of human beings and other higher animals, so there is a wide variation in the content of different minerals in the body. So, when we classify minerals, most essential trace elements, less essential trace elements, and non-essential trace elements are there. Then, disorders due to mineral malnutrition, hypokalemia and hyperkalemia, hyponatremia, then hypernatremia, hypokalemia and hyperkalemia, along with that hypochromatic microcytic anemia, disorders due to defective iron metabolism, then Wilson's disease due to defective copper metabolism, then hypochloremic alkylosis, dental caries, dental fluorosis, and skeletal fluorosis. Skeletal fluorosis and dental fluorosis are caused by excessive concentration of fluoride in the body. Then endemic goiter, pine disease, which are the major vitamins? Vitamin A, renitol, vitamin D, calciferol, vitamin E, tocopherol, vitamin K, naphthoquinone, vitamin B1, thiamine, vitamin B2, riboflavin, vitamin B3, pantothenic acid, vitamin B5, niacin, vitamin B6, pyridoxine, and vitamin B9, folacin. Then vitamin B12, cobalamin, vitamin C, ascorbic acid. Then vitamin deficiency disorders, for example, beriberi, pellagra, Wernicke syndrome, then pernicious anemia, scurvy disease, then infantile scurvy, rickets, then osteomalacca disease.